glaucoma. Now, this is often referred to as a silent thief of sight. You know why? Because it can cause vision loss without any noticeable symptoms. And that's why they call it asymptomatic. You'll be there, and then before you know, it's gone. Now, it's crucial to understand the risk factors and how to detect it early. As we celebrate World Glaucoma Week, we have in the studio with us president of and listen, this is a big word. I did that Greek, but I'll try my best. It's Ophthalmological Society of Ghana, Dr. Med Jefa Ofori Adjei. So that's Dr. Okay, so let me add another word. Dr. Med Jefa Bella Ofori Adjei. Doc, good afternoon, and great to have you in the studio.
Thank you very much. Great to have you too, and good afternoon to your listeners. It's exciting to be here for Glaucoma Week.
Okay.
Every year, we look forward to Glaucoma Week because it's a week that has been set aside by the World Glaucoma Association and the World Glaucoma Patients Association to create awareness about glaucoma, like you rightly said, because it's an asymptomatic disease, but the leading cause of irreversible, so permanent blindness worldwide, if not detected. And unfortunately for us Ghanaians, we are number 2 on the global league table, the glaucoma league table. We are next to Barbados. And historically, the slaves from Barbados are even said to have originated from Ghana. So our prevalence rate is quite high. Not only is it high, the severity of the disease too is really bad amongst us. So we want to create a lot of awareness about it, because once it's detected early, then we can prevent vision loss. So the key word is detecting it early. How do you detect it early? Through screening. Because it is asymptomatic, like you said.
And you said something really important about why we screen.
Yes.
That you screen because you can save the people who have it.
Yes. So we screen every disease and medicine that we screen. It's because there's an intervention available for it. So you only screen diseases that you can do something about. Because what's the point in screening for something, diagnosing it and not being able to do anything about it? Then it causes even a lot more mental trauma to the patient. So glaucoma, when screened or when detected early, can save you from vision loss. And that is a key point during Glaucoma Week. We are saying that it is okay to have glaucoma, but detect it early. And then let's treat it. Because once you treat it, you are as good as new. Yes.
When we say glaucoma, is it just a single thing, or we have various types of it? And if there are, how do they differ from each other?
So glaucoma is a group of diseases, related diseases. And the end result is that there's damage to what we call the optic nerve. The optic nerve is the power of the house, the powerhouse of the eye. So imagine your TV set with a cable that you connect to your sockets to generate power. The optic nerve is that cable. So imagine you have a brand new TV set and then the cable is not working. Then it means that you cannot use your TV set. So the glaucoma damages the optic nerve. And like you said, there are different types. But during Glaucoma Week, it is the one called the primary open angle glaucoma, which most people know is what we talk about. But you have the congenital one where children are born with it, but that one has signs, and symptoms. So you will you have those signs and symptoms, and it will bring you to the hospital. So you have the congenital one, you have the juvenile one, and then you have the glaucoma that is associated with other diseases. So you have something else. But we know that with that disease, there's glaucoma associated with it. So those glaucomas are there. But during Glaucoma Week, our emphasis is on the primary open angle because that one is asymptomatic. There's another one called angle closure that usually happens among the Asians. That one causes intense pain. The pain is such that you don't have a choice. You go to the hospital. Not common amongst most of us. Okay. So what we are focusing on today is the primary open angle glaucoma, which most people generically refer to as glaucoma. And that is the asymptomatic one.
I mean, earlier you said that Ghana is second.
Yes.
Only to Barbados. And even that we have some sort of historical linkage.
Yes.
Now, are we then saying that all of us are at risk, or there are some people amongst these two countries that are even at risk? And how do we even prevent
So
that?
there are risk factors, as we say, with glaucoma. One of the commonest risk factor is aging. Right. So aging is one of the commonest risk factor, and like I said already, being black. So the black race is another risk factor, and then a family history of glaucoma. So if you have a family history of glaucoma, then there's a 4 times chance of you having it. So family history is not your nana cancer. You're talking about your first degree relatives. So your siblings, your parents, then your risk of having glaucoma also increases. Okay. And these ones, we refer to them as not modifiable. You can't do anything about your race. You have to age. So there's nothing you can do about it. Okay. And then your family, what do? You don't choose your family. However, the major and modifiable risk factor is the intraocular pressure. Okay. So the intraocular pressure is a pressure that is specific to your eye. The same way you have a blood pressure specific to your heart, right? So there's one that is specific to your eye. There's a fluid that the eye produces. The rate at which that the eye produces it is the same way it excretes it. So it's in equilibrium. So once that pressure is fine, okay, the normal limit is usually anything between 10 to 21. So anything less than 21 is normal intraocular pressure. Okay. Now, with people who have glaucoma, there may be a problem with overproduction of the glaucoma, the fluid, that's the aqueous humor, or problem with the drainage, and that causes a backlog of the fluid in the eye. And that fluid is what compresses on this nerve we spoke about, the optic nerve, resulting in the damage. Okay. However, this damage doesn't occur overnight. It's a progressive, painless decrease in vision. So look at it like the cable I spoke to you about. There are different wires that make up the cable. And imagine those different wires fraying over time. So that is what causes glaucoma. So intraocular pressure, though not the only risk factor, is a major and then a modifiable one. So if you have glaucoma, then the goal is to make sure that the pressure is less than 21.
Okay.
So that is how we manage glaucoma, yes.
Oh, well, since you spoke about fluids, I got a bit scared because mine doesn't come as all of us.
Tears. Like tears is different. This
so
one
it's different
is
from
in the globe.
Okay, it doesn't come out.
No, it doesn't come. It's in the eyeball. You know when you're looking through at me, you can see my brown iris. Okay, most of the time we say it's black, but actually brown. So you can see it in the Caucasian. You see a blue-eyed blonde Caucasian. Yes. So that's gap between the glass in front of the eye and that iris, that structure. Okay. There's a chamber, and that is where the fluid is housed. Okay. So it is that fluid that we're talking about. So it's not something that you see with your naked eye. We see it when we examine you in the clinic, and we can measure the intraocular pressure. And the good news is that there are ways of bringing this pressure down. Okay. Okay. So once you are screened for glaucoma, so like I said, it's not only the intraocular pressure. There are other things that we look at. There's something at the back of your eye, the optic nerve I spoke about. We look at the caliber of the optic nerve, and we can tell, is it healthy? Is it not healthy? And then the other thing we look at is what we call your peripheral visual field, which is what glaucoma affects in the early stages. So in the early stages, your central vision, what we are using to talk right now, is intact. It is your side vision or your peripheral vision that it affects. By the time there is any noticeable reduction in your peripheral vision, then it means you've lost about 40% of the function of the nerve already. So that is why we don't want to get there. Okay, we want to see it. We want you to walk into a clinic once a year, or we want you to walk into the clinic once every 2 years to get your eyes checked. And at that point, when you don't know anything, you are diagnosed with glaucoma. That is the best time to catch it, because then there's no damage at all. Then we can prevent the nerve from getting damaged.
Interesting. So as we sit here, practically, how far to my side should I be able to see?
Okay, so we measure it in degrees. Okay. So it's difficult to say practice. So we usually use our arms stretched to use what we call the confrontational visual field. So from somewhere like this, you should be able to see me wriggling my finger. But there are machines that will actually test it for us to certain degrees that will be able to tell that, yes, it has affected your visual field. So when you go to the hospital, we will check your ability to read, where we give you the chart. And then you read this alphabet. That's the first one we do. We'll check it monoocularly, because glaucoma can affect both eyes, and it may be asymmetrical. So it may affect one eye. Your eye is severely damaged, one eye, and the other eye may not be, it's not that damaged. So it's important to check the eye monoocularly. So we do that. After that, we check your pressure, and then after that, we take a look at the optic nerve. And based on this, we will decide that you are at risk, or this is what we're seeing. So let's check your peripheral field in addition. Then we'll request for the visual field test, and then we can holistically diagnose you of glaucoma. And then it's at that point that we begin treatment. So all is not gloomy about glaucoma. The most important thing is that get to know your status. Do you have it or not? If you have it, then because it's a chronic disease, we'll treat it. So it's not like you are having a cold or you are having malaria, you pop the pills and then you are fine. It's chronic. So it has to be treated. It won't be cured.
Okay.
It will be treated. So it's treated. There are different ways in which we treat it. We treat it medically. With medically, we're using eye drops. Okay, so you may need 1 or 2 or 3 eye drops. Okay, by the time you are needing 3 eye drops, it means that the disease is very severe, right? And then the second option is surgery, which we advocate for a lot of people to do, because the eye drops, you can forget to put it in the eye. If you forget and the pressure shoots up, the nerve will get damaged. Okay, so if you're traveling everywhere, you have to remember to take your eye drops with you. But when you do the surgery, then you are, every time you're going somewhere, you just carry your bag and you go. You don't have to worry about the eye drops because the pressure will be maintained constantly. So surgery is another option. And the third option is laser that we put. So the whole essence of these methods is to reduce the pressure. So the surgery will divert the fluid. This fluid, I said, aqueous humor that can go up, will just create a diversion for it. So it is in the eye, but it's not present on the nerve to cause damage. So there are different ways of diverting that fluid. So there are different surgeries that you can do for glaucoma. And we say that for the African, glaucoma is a surgical disease because the drugs are expensive. You know, and I said it happens when you are growing old. And as you're growing old, you may have concurrent diabetes, you may have concurrent hypertension, you may have arthritis. So imagine you have to buy medication for all this. Then you are adding glaucoma eye drops to it, okay? Some of the drops are under the health insurance. Just a few of them, maybe 1 or 2 of them are under the health, but the bulk of it you have to buy. But if you do surgery early on in the disease, then you can actually save your vision.
Okay. But you said you don't cure it.
So the surgery will make sure that the pressure is normal. And if the pressure is normal, then there's not going to be damage to the nerve. If there's no damage to the nerve, then you don't get visual loss.
So it won't come again.
Yeah.
But then
you have glaucoma, but your pressure will be fine. It's like having BP. When you have BP and you take your medication, it controls the pressure. If you stop it, it will go up again.
Okay.
You understand?
But so this surgery sort of maintains the pressure.
Exactly.
And it won't go up again.
If it goes up again, because it's a diversion, it's a route that you've created, and say something clogs the route. And it happens often in black people because we scar easily. Okay. So that scarring can block the hole that we create, okay, or the outlets that we create. If it happens, we'll put another outlet.
Okay.
Yes.
Interesting.
Yeah.
Well, like they say, so in health, you say prevention is always better than cure then. So how do people prevent themselves from getting glaucoma?
By screening. Because we spoke about the risk factors. How do you prevent yourself from being black?
You cannot.
You can't. So you have to screen. And when you screen and you are detected, then you are treated. So remember that once you are on medication for glaucoma, you can preserve your vision. It is not knowing, that is where the danger is. Not knowing you have glaucoma. But once you know, then there's solution for you.
Okay. So it means the key word is we should all screen.
Screen, and not a one-time screening. Make it maybe a gift to yourself. So lots of studies have been done in glaucoma in Ghana. And they found out that 8 out of 100 people above the age of 30 and 9 out of 100 people above the age of 40 have glaucoma.
Hey.
Okay, all right. So, and I also said that a study was done previously in Ikuapem where they realized that a third of the patients who were diagnosed with glaucoma in the clinic, where they were already blind, or they already had visual impairment in one eye. You understand? So the statistics are staggering. So it is not a one-time treatment because you are growing. So if you are screening, we recommend that if you are above 30 years, once a year. If you are above, once every 2 years. And if you are above 40 years, once a year. So perhaps let it coincide with your birthday.
Well, so, I mean, when it comes to the screening, you have to walk into an ophthalmological clinic or something.
I see that today, dear.
I'm in love with the word.
I can see, yeah. You walk into an eye clinic.
Okay.
Okay, and these are the things that they should do. So they will check your vision, and then they will check your pressure, and they will look at the back of your eye. They will look inside your eye. It's important because when you're going to change your glasses, that is not glaucoma screening. Okay, you don't look at the nerve when you're checking your glasses. If you have Apollo, red eye, and go to the clinic, and that is not glaucoma.
But sometimes they check something at our back, and they're able to tell you that maybe fat is accumulating or whatever.
Yes,
so that's not part of it.
So that has to be done.
Okay.
And it's not done routine. Say if you're going to change your glasses, it won't be done for you. Or if you had a red eye, pink eye, Apollo, and you went to the clinic, it won't be done for you. So you have to intentionally say, I want to get screened for glaucoma, and then that will be done for you. So it is done in almost all the health facilities where there's an ophthalmologist or an ophthalmic nurse or an optometrist. So that screening is done, and once you are diagnosed with glaucoma, you'll be referred to see your ophthalmologist who will advise you. Okay, so we would recommend, we'll sit with you, look at your lifestyle, then we'll advise you with the treatment that will best suit you. Say you are someone who is always on the go, then eye drops is going to become a problem for you, isn't it? Because you have to remember to carry it all the time. Some of them twice a day, some of them 3 times a day, and then some of them is just once a day. So we would advise you based on what you do and based on the stage of the disease as well. The problem with this is that most Ghanaians opt for surgery when the vision is poor vision is advanced. Okay, at which point, remember that when you treat glaucoma, it doesn't bring back, I told you, the vision. Permanent. So whatever you've lost is gone. We are preserving what you have so that it doesn't get damaged. Okay. So most people opt to do surgery when it's so advanced. They realize that they can tell themselves going downhill, and that is the time they want to do surgery, and that is not the time to do surgery. Okay. Time to do surgery is very early on in the disease, so that you can preserve your vision.
Keyword: early detection.
Early detection.
So that you'll be saved. So people should go and do the screening to know that. So every eye clinic can do it for you?
Every eye clinic can do it for you. This week, the Ophthalmological Society of Ghana, we partnered with our colleagues on Monday at Emmanuel Eye Clinic. On Tuesday, we're at Ridge Hospital. Today, we did the launch at the Ministry of Health conference room. So we screened the staff over there. Tomorrow, we'll be going to Agbobloshi Market. Friday, we'll be in Bema Camp. And then Ridge Hospital as well. Tomorrow, Kolebu is also doing screening. And basically, most of the eye clinics in the government hospital and even private hospital are doing screening. And the screening is under the health insurance. So if you have a health insurance card, you can walk into any of these eye clinics and then get your eyes tested.
Okay, so that's happening throughout the week, but just even after the week, people should go on and then be checking, for glaucoma. And not just glaucoma, but other things. But because this week is glaucoma, we are focusing on glaucoma. Well, thank you so much for coming. But just before, maybe you have one thing you would leave us with on how we can ensure that we don't, we check ourselves not to contract this glaucoma thing.
So what I want to say is that do not be blindsided by glaucoma. Don't let glaucoma steal your sight. Get screened because there's treatment for glaucoma. Thank you.
All right. So that's Dr. Med Jefa Bella Ofori Adjei, I love that name, president of the Ophthalmological Society of Ghana. And she's a consultant at the eye clinic at the Kolebu Teaching Hospital. Well, I hope that when we go there, we won't have the issue with the dialysis that we had recently.
No, we won't have that issue.
You're okay. You're solid.
Okay. We are solid.
Solid as gold. Thank you for coming. Well, this is...